This is Lesson 5, BPPV Intervention. So today we're going to learn a bit about how we handle people who have vestibular dysfunction with benign paroxysmal positional vertigo and how we treat that. So these are folks that we've done the Dix-Hallpike test on. They definitely have positional vertigo because we've seen that upbeating torsional nystagmus in the direction of the ear that is down toward the floor. So that indicates to us that the ear that was down in the Dix-Hallpike testing is the impaired ear. So then how do we treat that? We treat it with canalith repositioning, or what's called the modified Epley maneuver. Now, we don't call it the Epley maneuver because when Dr. Epley first did his Epley maneuver, he actually used a vibrator on the mastoid bone at one point during the process. And since that is not done anymore, it's not been proven to be efficacious in the literature, Dr. Epley didn't want it called the Epley maneuver if it didn't include that vibratory portion. So now we call it either the modified Epley or the canalith repositioning maneuver. And what you see on the screen right now is basically a template from a handout of how a person would go through this, basically if they would do it on their own. So they're placing a pillow behind their back and leaning back over the pillow rather than the therapist controlling their head movement. Obviously, in the clinic, you would want to control their head movement and their head angles. The best way to have you see how to do the canalith repositioning maneuver is to watch the videos. So I'm going to have you stop this video and watch some of the videos that I've provided on how to do canalith repositioning. One thing I want to note is that the timing in the vestibular seminars video is the correct one, that you want to wait in each position for the vertigo and the nystagmus to stop, and then 30 more seconds. There's one video that says 15 to 20 seconds total, and that's a physician doing that. And I always like to joke, physicians are always in a hurry, so they take less time in each position. But it's always better to take longer in each position because while you wait, those crystals are sifting through that canal and falling out and getting out of where you don't want them and getting back into the vestibule where they do want them, where the body can either reabsorb them or stick them back down. We don't really know which it does. We don't really care which it does, just so long as they get out of the way and don't cause the problem anymore in the person so that they're not dizzy anymore. So watch those videos. I hope you enjoy them, and then give this a try. And here are the video links, which I'm also placing in the lesson. I also want you to practice this. So as you're doing this, some of the common mistakes that people make is they'll take hold of someone's head, and as they're bringing them back in the Dix-Hallpike position, instead of keeping their head, well, first of all, they'll forget to turn their head first. You want to turn their head 45 degrees first. Don't turn it as you're bringing them down, or don't turn them once they're down. Turn their head, bring them back. Another common mistake people make is that they turn the head to the opposite side as they're bringing the person back. You don't want to flip their head around. You turn their head, keep it turned, pull them back into that Dix-Hallpike position. If you see the nystagmus, you can actually go ahead and start to treat them right after you've tested them. You wait for the dizziness to pass, and then 30 more seconds. Then you're going to slowly rotate their head from 45 degrees to the right to 45 degrees to the left, or vice versa if you're treating the other side. So they've gone 90 full degrees, from 45 degrees one direction to 45 degrees to the other. Don't pick their head up as you're turning their head, because then you're shaking those crystals around. You want to let them roll through the canal. So dizzy plus 30. Then you have them carefully roll onto their side without picking their head up. Don't lift their head or their body up. And now their head is another 90-degree turn, looking down at an angle toward the ground. I call this the armpit sniff position because they actually are going to tuck their chin and put their nose toward their armpit. So everybody knows what to do when you tell them to do that. It's a good way of helping remind them to tuck their chin as they're turning their head over. Dizzy plus 30 again, and they're often very dizzy in that position, and you want them to be dizzy because that's where the crystals are dumping out of where they don't belong. So if they're dizzy in that position, tell them to hold on for the ride, that it's actually doing good for them, that it's going to help them to get better. Then you slowly help them sit up, keeping their chin tucked as they come to sitting, bringing their head then straight forward. Hold that position for a while and keep your arm around them for a while. I've had people want to go falling over backwards after that maneuver. You think they're fine, but it has sort of this latent sense of vertigo with it. So wait for it. Give them a good 2 minutes, kind of sitting there with your arm around them and making sure they're okay before you move on. Now, horizontal canal is a little bit different animal. You might suspect that they have horizontal canal if you've tested the posterior canal and you're not finding anything, no nystagmus, or you put them in the Dux Hallpike position and you see a horizontal nystagmus. So you actually want to test them with the roll test, lying flat and turning their head. Again, I recommend you watch the video for that. And then you treat them with the barbecue roll or the Lempert maneuver. And this is a schematic of how that maneuver goes. Some people have them turn 270 degrees, and some people have them go the full 360 degrees. So it all depends on which method that you've been taught as to what people do. I tend to go the full 360 degrees because I know that it's going to work for them. So I have them start out lying flat, and I turn their head to the impaired side, so whichever side had the most symptoms. And then you're going to go 90, 90, 90. So you're going to go 90 degrees to the center, dizzy plus 30 if they're dizzy, 90 degrees left. If their neck is stiff, you can actually turn the body, because it's not about their head on their body. It's about their head position in space relative to gravity. So you can rotate their shoulders a little bit. Then you have them go prone and try not to pick their head up. Maybe they can rest their head right on their hands, and wait there for another dizzy plus 30. They're often dizzy there. Again, that's where the crystals might be dumping out. And then this particular video does take them that last 90-degree turn. They turn back onto their side, the original starting side. And then from there they can slowly sit up. And they might feel dizzy when they sit up again, so guard them. And here's the full video where you can watch the Lempert roll in action. Now, before I close, one thing that I do want to say here, I'm gonna back up here, is precautions after you do the modified Epley maneuver or the Lempert. It used to be in the past that we would tell people that they had to go home and wear a cervical collar and sleep upright for 3 nights, like in a recliner. We don't do that anymore. The literature has shown that that's not any more particularly effective than if we don't give them any precautions whatsoever. So generally what I tell people to do is to go home and try to stay up for 4 to 6 hours to give those crystals a chance to dissolve. Just try to not lie flat for that 4 to 6 hour period. And if you're going to give them the home exercises to do, which I'm also going to provide you that link to see how that is done, that they shouldn't do it right before bed. Now, that being said, I once had an elderly gentleman who I treated, and then he was an inpatient, and he immediately went down for an MRI testing, and he was absolutely fine. He actually, even though he had to go lie flat for, however long you have to be in the MRI machine, he actually, the next day, his BPPV was gone. So it can be effective even if they do lie flat. So that's it for this lesson, and thanks. We'll see you next time.